what unique ethical challenges does COVID-19 present to journalists, given that the population is relying on the media for information that's concerning matters of public safety? These are questions of life and death in some cases. So we'll start with Daniel.
Sure. So I think it's a very good question, because sometimes when you're a journalist, you're just thinking about the next story. You're not actually thinking, is this an ethical story? Is this something that is good for the greater good? And so I think one thing the media has wrestled with is how much airtime to give those briefings, especially since there's a lot of misinformation and people don't trust what those briefings say. And what Trump says during them. And so should CNN and MSNBC air them in full, or should people just watch on C-SPAN or on the White House's website if they really want to tune in? Even a few days ago, you had the Trump press office try to put CNN in the back and move up a pool reporter, a non-CNN reporter, to a prime seat in the front. And so this is kind of a way to punish CNN for asking tough questions. And I think, if I looked at some of the stories that I've done recently in terms of thinking about them in an ethical lens, and I think the work that many journalists have done in the last month or two to hold the government accountable, that's incredibly ethical, because people who did not prepare well enough for this crisis, whether they're in the federal government, even in the former administration, in the Obama administration, or among governors, and especially in the Trump administration at HHS, the history books should reflect that fact when they didn't, have enough tests, and the strategic national stockpile, which is set up for an emergency like this, doesn't actually have enough ventilators, and there's not enough masks, and we've outsourced all of our, PPE production to China. And so that has led to thousands of deaths, and prioritizing what, economic experts wanted in New York City, for example. So Bill de Blasio, if they had shut down New York 1 or 2 weeks earlier, they might have had 80% fewer deaths. And de Blasio, even after what happened in Washington State, he was saying, hey, it's fine to go out, don't change your, stay in, continue to support the economy. So some of my stories that I've done in the last few weeks, they looked at how DHS, they stopped doing pandemic modeling a couple of years ago, which is, DHS wasn't very happy with that story, because I was pointing out maybe that was not a wise decision, especially when you had Alex Azar, the HHS secretary, say that was something that kept him up at night. And then the Trump team, they used one of their top economists in the White House, who had received, whose think tank had received $1 million from United Health. Of course, he is working to oversee United Health as they dole out billions of dollars at HHS. And so I don't think that guy is going to talk to me anymore. And then one more final story that I think has an ethical angle is during the transition, the Trump administration, the senior leaders, they were given a briefing by the Obama folks. And one of those was that there could be a pandemic, the worst influenza outbreak since 1918. That was on their packets that they got. And some of them were not paying attention. They didn't actually read the materials properly. They kind of just sat in the meeting. Wilbur Ross fell asleep a couple times. And so that is, you have to do that journalism now as that stuff is fresh and current. And of course, there's probably going to be a commission, a blue ribbon commission that looks at all the shortfalls, but they'll be looking at stories that my colleagues and I are doing to try to put that report together.
Thanks, Daniel. Mei?
Well, I think one of the big ethical considerations journalists will have in covering the pandemic is, COVID-19 is like one of those magic markers that you take that sharply outlines this massive inequality that's in the society, right? So suddenly now we can see where the vulnerable populations are that are most hit by this. You might say a virus hits everyone equal opportunity, but that's not necessarily true. It seems to it has a much more stronger effect on people who have less health coverage, who are in more areas which are more vulnerable. There's plenty of data now showing how it's disproportionately affecting Blacks and Hispanics. And also, I think one of the very interesting ethical quandaries that's raised is, what do you even call it? Do you call it the Wuhan virus? Do you call it the Chinese virus? Which is, I think, one of the stories we just ran today for the Center of Public Integrity was a poll that we showed that more than 30% of all Americans have actually witnessed, incidences of hostility towards Asian Americans during this whole COVID-19 pandemic. And that, I think, is, very strongly correlated to what it's being called. And when we ran that story, some people are like, well, it did originate in China, this didn't happen in some alpine village. Why shouldn't we call it the Chinese coronavirus? But, there are all sorts of ethical considerations there. One, scapegoating. Two, there's a differentiation between China, the nation, and people who are Chinese like me, but not China from PRC. Three, there's very strong correlation between incitement of violence. One of our stories we showed, right after Trump started calling it the Chinese virus, I think it was March 16, there was a sharp spike in calls to depression, anxiety sites from people identifying as Asians. Words lead to actions.